Welcome, everyone. Today, we are here to award the Ira V. Hiscock Award. The Ira V. Hiscock Award recognizes a Connecticut layperson or organization that has made notable contributions to the advancement of public health through public service, education, advocacy, and/or leadership. To introduce our Ira V. Hiscock Award winner is Amber Kapoor. Amber?
Thanks, John. I met Reverend Robin Anderson a little more than 2 years ago through my role in community outreach at Middlesex Health. I've had the fortune of collaborating with her on many initiatives in that time, and reflecting back, I'm amazed at what we've accomplished, all thanks to Reverend Anderson's commitment, innovation, and trust the community has in her. Reverend Anderson has no formal public health training, yet she embodies everything the field stands for. She is passionate about health equity and devotes countless hours to improving the health of our community. She is unpaid for much of this work, but is unwavering in her commitment to fostering wellness among our community's most vulnerable citizens. Reverend Anderson is the director of the Ministerial Health Fellowship, which brings together pastors and church leaders of 30 primarily Black and Latinx churches from the Middletown, New Britain, and Hartford areas to build knowledge of healthcare issues and advocacy and forge connections with healthcare providers and public officials to address systemic barriers to access to healthcare. She also co-leads the Greater Middletown Area Health Enhancement Community and is an active member of the Hartford Health Enhancement Community. In response to racial and ethnic disparities in COVID-19 morbidity and mortality, Reverend Anderson brought together a broad base of nearly 20 community stakeholders to form the Middlesex County COVID-19 People of Color Health Initiative. This group quickly mobilized in the early stages of the pandemic to provide thousands of masks, 1,000 wellness kits, and prevention education to those in need. On behalf of the Ministerial Health Fellowship and the Greater Middletown Area Health Enhancement Community, Reverend Anderson has further secured grant funding to employ crisis counselors across Hartford, Middlesex, and New Haven counties, and to help stabilize community members and connect them to resources in the wake of the pandemic. She's also secured funding to engage trusted messengers in the Middletown community to disseminate essential information about COVID-19 to communities of color, as well as funding to support basic needs for individuals and programs impacted by the pandemic, and funding to employ 2 community health worker doulas to improve maternal and child health among BIPOC individuals in the Middletown area. These are just examples of the amazing work that Reverend Anderson has done in the Middletown community. She's also actively working on public health issues in the Hartford and New Haven communities. I'm honestly not sure when she sleeps, or if she sleeps, I guess. Reverend Anderson is consistently recognized as a leader by local and state government officials, and as such has been invited to sit on countless panels, committees, and cabinets for the betterment of our community, including her most recent appointment to Governor Lamont's COVID-19 Vaccine Advisory Group. Reverend Anderson's efforts have undoubtedly advanced the health of our local community and the state of Connecticut through public service, education, advocacy, and leadership. I'm so proud of all that she has accomplished and see many great things in her future. It is my distinct pleasure to introduce Reverend Robin Anderson as the recipient of this year's Ira V. Hiscock Award.
Thank you, Amber, and also John. I wondered who in the world was Amber talking about. I am so very honored and humbled to accept this award with great thanks to the Amber who saw that in me enough to saw the work that I was doing and really wanted to nominate me. I am one that always gives honor and praise to God, because the work that I do is part of me being a servant leader in the faith community, as well as in working for over 32 years in the behavioral health field, and really seeing the need for persons that don't always have a voice and not able to advocate for themselves, and also seeing many of the conditions that they are in is due to their inability to have access to proper health care. That is one of the things that continues to fuel my advocacy work that I do. I am not going to stop. I remember one of the models that I use is that Calvin Rolock from the United Black Fund would say the only one that can save us is us. And so people of color really, it's important that we continue to mobilize ourselves, and that even as we face this COVID-19 pandemic, as well as the racism pandemic that's been going on for over 400 years, we cannot stop until we make sure that each and every one of us, and especially those in our community, those in our churches, those in our home, have access to adequate health care and are able to take care of the needs that they need to take care, and are not treated as second-class citizens, but they are part of the community, they are part of this world, and we are part of this nation, and we deserve to have the care that we need to make sure that we keep ourselves healthy, to keep our families healthy, and also to keep our communities healthy. So I am very honored with this award, and thank God for the Ministerial Health Fellowship, each and every person that's a part of that makes up the fellowship. I cannot do this work by myself. And so it's them that continues to fuel me to make sure that we're in the forefront of advocating for policy changes that will address disparities, as well as also able to, make sure that health care for people of color is at a range or a level in which everyone deserves to have free or access to health care services. And that also, that as part of the health equity work that I do, is to really make sure that all of us, not equitable, but have exactly what we need. And so I am just so very honored to accept this. I can also thank my family members who have put up with me in my busy schedule and all of the work that I do. And also thank God for my congregation, the Blackwell AME Zion Church in Hartford, Connecticut, where I pastor, as well as an associate minister at the Cross Street AME Zion Church, and also my pastor, the Reverend Moses Harville, for all of the support that he also gives me. And thank God for partnerships like Middlesex Hospital, Community Health Center, and so many other opportunity knocks, as well as our Common Council of Middletown, who was one of the, who in the advocating for that and actually talking to the mayor about possibly making Middletown declare racism as a public health crisis. That it did not take much to convince them that that needs to be so. And so we were the 7th town to declare racism as a public health crisis. So again, I could go on and on and on, but really I'm very humbled and I'm very thankful. But like I said, the work is not just me doing the work. I could not do it without the community, without the Ministerial Health Fellowship, the People of Color Initiative, and also the Greater Middletown Health Enhancement Community, as well as the Hartford Collaborative as well. And so together we're able to achieve much, and together we're able to make a difference in the lives of so many others. And I'm not going to stop until I close my eyes and knowing that we can make a difference in other people's lives, and people deserve the right to have access to health care, and also no matter what color they are. And also the fact that I'm not going to stop until we dismantle racism, systemic racism, as well as structural racism, because everybody deserves the right to a good and wholesome, healthy life, no matter how old and no matter how young they are. Thank you so much.